a baby after 7 root canal removal. This young lady has been trying to get pregnant for 10 years. When we took some x-rays, I saw she had 7 root canals, and about 3 of those root canals were on energy field of where ovaries are. Now it's 1.5 years after root canals were removed, and she has a 1-year-old baby. It's amazing, and it's a beautiful baby girl. Sometimes we can actually do some beautiful effects on our patients.
I've never seen a cancer patient that didn't have an oral infection. 100% of the cancer patients I've consulted with, it's been dozens, if not hundreds. I've never seen a cancer patient that didn't have an oral infection. I encourage you, that's the first question when people come to me and they say they got cancer, a primary tumor that's even metastatic disease. I go, do you have any root canals? Well, I've seen patients with ALS type symptoms, neurological symptoms that were poorly managed for 10 or 15 years, and we just have a conversation about root canals, and they roll into the dentist into a wheelchair and they walk out. Wow. They walk out when they clean up the infection. I mean, it's the most, same thing with my dad. My dad was chronically ill. He had a car accident in 1984. He's paraplegic and had a number of chronic conditions, and same thing, we couldn't get him better. So I took him to a dentist, got all the mercury removed from his mouth, got the root canals, teeth extracted, cleaned up the infections, and remarkably, he's doing great for a 76-year-old paraplegic.
Wow. Number one cause of heart attack is a root canal treated tooth. Plain and simple, not correlation, not link, cause and effect. So many family practitioners, internal medicine practitioners, my fellow cardiologists, see a patient that has a heart attack and they find the cholesterol's okay, the lipids are okay, there's no high blood pressure, there's no risk factors, and they think that patient just had bad luck.
What we found was that regardless of how well the root canal was performed, by far the vast majority had a high degree of toxicity. There were not one that was non-toxic.
Root canal simply cannot be sterilized inside the mouth. It cannot be put into a situation where the infection inside the root canal can ever be resolved.
And it's not sensed locally because the tooth, when you root canal it, you disconnect from the nerve, so there is no more sensitivity, so the patient can't feel the toxic effect, can't feel the death.
Most of these things aren't genetic problems. This person for the first 25 or 50 years of their life was okay. Now they're not. This isn't your genes. This is your body's toxic. And if we can restore those things, you can get your health back and your energy back, and you can have a fun life.